So, hi Marie, how are you?
Hello. Good. Well,
So,
thank you.
today we're just going to have a little chat with Marie Fell, who is a Pilates physio, so a women's health physiotherapist and also a Pilates teacher. And as you all know, I'm a Pilates teacher, but I'm really passionate about pelvic floor health and abdominal core health as well, for postnatal women. So I just wanted Marie to come on and ask her a few questions about that and about returning to exercise generally, and some considerations that perhaps women need to think about or it would be helpful if they thought about. Um, and one of the first things I wanted to ask you, Marie, was what do you actually consider time frame wise as being the postnatal period?
Well, we say as physios, once you're postnatal, you're always postnatal. So it doesn't matter if you're days, weeks, months, years, forever, because you will always have pelvic health symptoms, issues that will keep recurring. So if they don't catch you just after you've given birth, they might catch you when you hit your periods again, or when you hit menstruation, when you hit menopause. A lot of people's obstetric history catches up with them at menopause when things slow down in terms of their hormones and maybe organs head south, and then the obstetric history unravels massively. So once you've had a baby, you're always postnatal.
I'm really glad you said that because when I advertise my postnatal stuff, sometimes I say, if you haven't done any exercise and you've got a 2-year-old, come to my postnatal classes. And people are like, well, I'm not postnatal. I'm thinking, well, you are.
Yeah.
So I'm really
Yeah.
glad you said that actually.
Yeah. I think it's a big misconception because I know when I had my daughter, I got back to work at about 6 or 7 months after having her, but I still remember 10 months not feeling very strong. And even now I'm 2.5 years and I'm still postnatal. I'm still not, my abs are not as strong as they were. I've just not had time to do it.
Yeah.
So I consider myself still postnatal and I'm still working on it. It's a daily thing. Yeah.
So the other thing I wanted to ask you, and I think we've talked about this in the past, haven't we, when we've had conversations, is that I feel that there's a lot of pressure on women to just spring back. It's almost like they've not even had a baby. It's like, I'm back in the gym, I'm back running, I'm back doing X, Y, Z. And it's what the implications are of that really, and perhaps thinking about a slightly different way of approaching their return to exercise.
Yeah, I think there's a lack of awareness, for one, about what we need to be looking out for as postnatal women. I think there's a lot of tiredness and you're bottom of the pile in terms of priority and looking after yourself. So I think we bury it. And I think some people's coping mechanism is maybe just to get back to exercise because it's a way of them to regain their control of them in terms of postnatal and how they've changed, because you just change so much when you've had a baby. So I think a lot of people use that as their mental health release as well. So there's two sides of it, because I can understand why people are desperate to do something for them, but I think we need to tackle the awareness, particularly around pelvic health, and just help guide people a little bit better. Because the amount of people I've seen in clinic as a physio, that have come 2 years after and done so many abdominal exercises, and they've got this huge river down the middle of their tummy, which we know that diastasis can present as like the pouch tummy, but it can also represent as like the really deep invagination, where people have just caned the sit-ups to get their tummy back, and then obviously they've got this separation. So it can appear in different ways, and most of the women just say, we just didn't know, nobody told us, why did we not know this until after there's a problem. So unfortunately, I think for a lot of people, until there's a problem, it's not on their radar that they need to get checked.
And that's really interesting, isn't it? Because, I can understand women want to get or feel stronger and their tummy to feel better, don't they? I can understand that. But there's a bit of a conception about, I've got to do loads of crunches and abs and all that kind of stuff, isn't there? Which we both know as Pilates teacher isn't the best way to go, is it?
No, it's not. And the new interesting research that's coming out about diastasis is really interesting, because they're saying that no exercise is harmful, which is a really important message, and that we want to get people back to doing sit-ups and things, but they need to be able to first breathe correctly, they need to be able to manage their intra-abdominal pressure correctly, then they need to load it. So it's like a 3-step process, whereas I think a lot of people are diving into step 3 without knowing about step 1, 2 and then 3. And that's where we often try and regress people to progress them again. And a lot of people don't want to go backwards. They want to keep charging forward. So it can feel a bit like we're pulling people back with what we're saying. But I think it's the education and the empowerment around that, understanding why. So we've got a lot of work to do as women's health physios to try and get that message out there.
So what would you say to somebody sort of in the first, say, the 0 to 3 months
postnatal? Yeah, so there's a lot of there's some new guideline research come out about return to running. I don't know if you've seen those guidelines written by the physios. And they're now saying anyone postnatal, post-vaginal delivery or post-cesarean should wait at least 12 weeks before they return to running. And within those guidelines, there's really strict criteria about what they recommend you should be able to do in terms of strength and load.
I saw one of the videos you put on. It was the single leg calf raises.
Yes.
They're hard, aren't they?
Very hard, and you've got to do them in repetition. I think it's 20 of each on both legs.
Yeah.
And a lot of people always have a deficiency on one leg, so that's really interesting that you should strengthen before you load. Again, it's just building your body back up. So in terms of 0 to 3 months, and even this is a tricky one because it depends if you're struggling with infection, depends how you're bonding with the baby, with the feeding, with the sleep deprivation. But we would encourage people as physios to work on their breathing pattern, to work on their pelvic floor squeezes, just gentle, just starting to get some blood flow down there. And also you can start to work on the activation of your core, lower tummy muscles, just gently switching them on, switching them off. Particularly functional, because if you've got a toddler and you've got other children and you're going to be bending down and lifting and picking up washing, you need to have some awareness that your core muscles are starting to switch on. So we don't think 0 to 12 months you should be doing nothing at all, because it's just not practical. But equally we just need to be, and I've seen this a lot recently, but we need to be telling ladies about the lifting, the heavy carrying, the wet washing, picking up kids, stuff like this needs to be toned down a little bit to allow your body to recover. And then there are other movement exercises you can start with, like walking is great, isn't it? Just to get out and get some fresh air, and trying to work on your posture so that you're nice and tall and you're not slumped over the pram. I know I was supposed to sit up when I said that. But just little things that make a huge difference in the first 3 months, and preparing, getting that strength back, like from what you've just said, single calf raises. And single sits to stand is so hard, squats on one leg.
Yeah, really. Yeah. That's really interesting. I mean, in terms of relaxing, being in the body and swimming around when people are breastfeeding, and it can be around for quite a long period of time, can't it? And I think that doesn't just affect tummy muscles, it affects lots of tissues, doesn't it?
Yeah.
So, yeah.
And there's definitely a thing about when you stop, if you're breastfeeding for a long period of time, you will still tighten up after. I know that a lot of people think there's a window of 8 months before you're meant to get your natural body tone back in terms of like diastasis and tummy separation. But I fed my little one for 15 months, and after I stopped feeding her, I noticed this. I don't know how to explain it, but it's kind of like this sucking up action. Things just feel like they suck back into joint, or that kind of little bit of laxity that you've got kinds of firms up again. So there's definitely hormonal changes that are applying throughout. And a lot of people are breastfeeding their babies a lot longer than previous. My mum didn't breastfeed any of us. So, I think it's there's a bit of a tidal change with that as well. But again, it's being aware of that, if that applies to you. Yeah.
And what would the advice be in terms of somebody that's had a C-section?
Yeah, so this is tricky. So it's in terms of running, obviously what I said about it, I've seen mums at 6 weeks post C-section that just want to get back to running. They're ready to run. And I'm like, no, slow down, wait. And then myself that's had 2 C-sections, there's no way I'd want to get back to running at 6 weeks or 3 months. I'm just like, no. So everyone's individual, and it depends on lots of factors: the scar, how it's healing, how you're feeling, what type of cesarean you had, so whether it was emergency, whether it was planned, whether it was a crash one where it was life or death, which are a lot rarer but can lead to a lot of trauma. And I think I've been doing some interesting work recently on C-section and energy shifts, and there's lots of neuroscience evidence to say that a lot of women that give birth by the C-section completely disconnect from their pelvis due to like anesthetic, obviously, because it numbs it, but they just have no energy down there.
So interesting.
Yeah, and then one of the easy ways to just check that is just to put your hand over your C-section scar and just see if you can breathe into that scar, and whether you can actually get a connection and get the breath into that part of your body, because the evidence shows there's lots of reduced vibration frequencies down there for women. And because they haven't birthed baby down through the birth canal, it kind of just gets stuck at the pelvis and the energy doesn't continue. So
yes, that's similar to sort of the neurological pathways, isn't it? The brain.
Yeah. So I think C-section's really multifaceted. It's got lots of dimensions to it. It's not just the physical. It's not just the emotional, social. It's energetic. It's lots of things impacting on it. And then I guess if you've got older children as well, having that on top is also another kind of piece of the puzzle. And I think a big slice of the cake is, do you have support, and how well are you supported as a mum? Or a postnatal person, because I think a lot of us don't have the support that we need, and that's why a lot of us get back to trying to do too much too quickly and don't rest. I think so. It's very tricky in the modern world to rest.
So in terms of, with your physio hat on, what would you like to, I mean, it's, some of it is educating and enabling people to access physiotherapy, isn't it, postnatally?
Yeah, so we have a problem there, because I did some figures on this recently. I think like in 2018 there was 731,000 births in the UK, and we don't know, and this is really shocking, but in terms of women's health physios or pelvic health physios, there's only about 900. So the numbers are just not there in terms of trying to get everybody to the women's health physio. And in terms of, I know there's a lot of things kicking about at the minute about we're trying to push for the French system of women, every woman should have the pelvic floor re-education like they do in France. From being here, because I live in Luxembourg at the minute, and it's interesting because I went to get my pelvic floor because I was like, I'm going to get it. I'm in Europe, I'm going for it. And it was interesting for me because obviously I've been trained and I can assess, and it was basically, here's a machine, here's the gadget, 8 sessions on the gadget and then go home. It wasn't an assessment.
Right.
So I think in terms of how the UK physios treat people and assess people, it's way more in depth than what you're offered in Europe.
Right.
So
so there's a misconception there, isn't there?
I think there is. I'm kind of played a bit quiet about it, but I'm going to speak up to my board soon, because I think, everyone thinks the French system is the holy grail and it's amazing. But my experience of it, and from me speaking to women here in this country and in Europe, a lot of people don't like it, don't want to have it, don't like having it done, don't see the benefit of it, don't go for it. So I'm not sure how.
That's counterproductive then, isn't it, really?
Yeah, it's counterproductive. And I think, like, if you were getting a full assessment, which is what the UK physios are trained to do in terms of pelvic floor, then that's interesting, and then you get the rehab. Whereas if you're just going to go sit with a probe for 8 sessions, it doesn't always give you the right information and the training that you need to downtrain or strengthen, depending on what your problems are.
It's really interesting, actually. So in terms of what physios can offer, what would you sort of suggest that they can offer them, in terms of both C-section ladies and vaginal deliveries?
Yeah, so I think anyone postnatal, I would strongly advocate, if you can afford to pay for a private postnatal pelvic health physio, then almost it should be like your baby shower present, your baby present, your birth present should be that you, because how many gifts do the babies get and what do the mums get, so I think I would strongly advise that. So there's the Mummy MOT that have got practitioners up and down the UK that are private. There's lots of women's pelvic health physios in your area that treat privately and would love to see postnatal women, but it's not free, unfortunately. And I think at this time it's kind of like we kind of have to promote it as a service that is paid for rather than free, because in the NHS it's such a postcode lottery. It depends on the clinical commissioners as who funds what. So like for Nottingham, for example, they don't get funding for GP referrals, you can't get referred in, and in Derbyshire there is no continence physios in the women's health team, and it just up and down the country it's so varied. So in terms of what physios can provide is a lot. In terms of can they provide it, they can't. Yeah.
So just to summarize, returning to exercise then, the 3 steps that you mentioned earlier on were breathing,
intra-abdominal pressure. That probably just to most people think, what on earth is that all about? But that goes into constipation, it goes into like, can you transfer load across your abdominals well? Can you activate your pelvic floor functionally when you need it to? Can you release it as well afterwards? And also the functional part of that is that you shouldn't have to switch it on and off, it should just automatically come on. So that's what you're aiming for. And then obviously then the strengthening and the loading bit is the sit-ups and the curls and the adding pressure to progress the load.
So it's all the breathing, the pelvic floor and core stuff, the intra-abdominal control stuff first, and then the strengthening and the load.
Yeah.
So that's
and combined with function, because it should always be functional. So I think gone are the days where we always lie everybody down to get them better. We should be standing. Yeah. And I know that we need to lie down to do some exercises, but we need to do a lot of them more upright, because how many mums get the opportunity to lie down and practice? It's exactly, never.
Whatever age your children are.
Yes, yeah, exactly. So it's for life, again, postnatal for life. So it's about making it functional.
I like that phrase, postnatal for life. That's really reassuring, actually, and I think that's a really good way to look at it.
Yeah, because it's amazing when you'll know this in Pilates, but when you get women, I used to screen everybody for, have you had children, what are the age of your children? And as soon as they say yes, they've had children, I kind of want to know more about birth history and any problems, any pelvic health symptoms. And I would always question it, not to be like rude or kind of just nosy, but you need to know, because that will obviously affect their Pilates, for example, your core.
Totally. So the next sort of area I just wanted to have a chat with you about was continence, really. I know exercise and continence aren't separable, really, but I just wanted to kind of bust the myth as to, I think what happens is most women see continence issues as being a menopausal, sort of my age, my children are teenagers now, but you kind of think, oh, I don't have to think about continence when I've just had a baby, unless you sort of really are suffering.
Yeah, I think we need to blow this one out of the water, and hopefully the online survey that I did at the beginning of the year will help, because we know the statistics is 1 in 3 post-birth women will have incontinence, and we know from social media a lot of the younger people are coming forward, especially in the media, like Fern McCann and all these celebrities starting to speak about it. But the online survey I did in February, it showed that it was 3 out of 4 women.
So that's pretty much everybody then, really, isn't it?
That's a heck of a lot more than a third, isn't it, that we thought it was. And I think as women's health physios, we knew the number was higher, but we didn't have the proof for it. So if we can start to turn this into a bit more of a research project, it would be very interesting to get some stats on this and get some figures.
And are you hoping to turn it into a research project then?
Yes, definitely. I think that's how we need to drive it forward, is to try and get into research and get more research out there, to get it publicized, to then make people more aware. So research has a lot of clout, so we need to try and get behind it and just get some numbers. I mean, we don't even know how many women's health physios there are, but we need to pin it down, and we need to find out. So I think as my role, because I've sidestepped to Luxembourg, I think I'm going to try and fill that clinician research role in there.
That'd be great. Actually.
Yeah.
The other thing about continence is the myth, or the maybe misunderstanding as to what continence issues actually are and how they start. Because I remember you doing a little snippet, which I found really helpful, was that even if you leak just a little tiny bit infrequently, then that is a sign that your pelvic floor needs to strengthen, isn't it?
Yeah.
And I think,
carry on.
No, carry on, Marie, that's fine.
I think with possibly COVID as well recently, we know there's a lot of people been coughing, and if you just leak from that one cough, you've still had a pelvic floor deficiency there, or insufficiency. So even just that one leak doesn't mean to say that you're not incontinent. Even if you just sneeze once, or laugh once, or cough really hard once and you leak, it's still leakage. So it's still incontinence. That's incontinence, is leaking from any passage in your body, bladder, vagina, or bowel, because we also know a lot of postnatal women leak when they get out of the bath, and that's a really common one.
Yeah, and I remember seeing that snip, and I've done Diamond Pilates, which we went into a lot of that, and that's one that I hadn't thought of, actually, and I thought, oh yeah, actually
it's really common. And I know when I was teaching in England, when I mentioned it, the look of relief on everyone's face, they would be like, oh, so it happens to you? It's like, yeah, it does happen to most people, but again, it's embarrassment. You don't want to mention it, or people don't talk about it because it's guilt or shame or whatever. But yeah, continence is not just like where you're leaking every day, all day. It is like the odd cough or the odd sneeze, like from a stress response. That if you leave it, when you hit menopause or something, it might catch up with you and the floodgates open.
And it does.
So you've got the warning signs.
Yeah, it does. I mean, one of the things, because why I asked you to do this is myself and Sue Booth, who are both Pilates teachers, we've both done the Diamond Pilates. So we're trying to encourage women, A, to talk about it and get support and not feel that they're on their own and it's something they shouldn't talk about, but B, to be more aware of people that can help them, like the women's health physios and the continence services and and all those kind of things, so they do feel that there are services there to support them. And postnatally, I think, as you said right at the start, women put themselves to the bottom of the pile, don't they? So they perhaps just soldier on and don't think about their needs because they're so focused on the baby.
Yeah, and you can get to like my point where you're 2.5 years postnatal and then you go to the doctor and say, I'm not happy about this, and you can be fobbed off because it's like, you've had a baby, you're tired, what do you expect? And you know, you might be brave enough and say, no, I want this, and I feel empowered, I've got this knowledge, and you just hit resistance. And I think that's so disempowering, and it can really put people off. So yeah, knowing if you can get to someone, the problem is getting to that person sometimes isn't as easy as we'd like it to be. So if you can afford it, it's best to go private.
I know, which is hard, isn't it? It's a really hard thing to say because actually,
it is. Because it automatically means a lot of people are not being seen. But I think, I mean, what I've been working on behind the scenes is trying to create like a triage system in how we get everybody seen, because obviously we want everybody to have a 6 to 8 week postnatal check with a pelvic physio in the future. It's what the 10-year plan's aiming for. But what they say is that it's for all new mums with problems, you know, that need the treatment. And not everybody identifies as needing that treatment or having a problem. So that's where we need to groundwork in the next years to get to that point. And then me and a team of other physios have kind of proposed that we do a triage system where everyone gets to fill in this questionnaire. Then if anything's flagged up, they can either self-refer or a clinician can highlight it and refer it on. So at the minute in the UK, what they sometimes do is triage groups, where they get you into a group and they do like a group session on prolapse or a group session on diastasis, for example, tummy separation. And then from there, you could get triaged onto maybe a face-to-face if you've got big problems that really need a one-to-one assessment. So we can kind of triage it better so that everybody's got a bit of awareness, and also people know how to get through the system.
I mean, it's quite just to recap, it's quite a big number of people, isn't it? 3 out of 4 postnatal women will have some continence issues. That's a huge amount of people, isn't it?
Yeah, because 3/4 of the population, I mean, it's obviously ours was a small number of people that we got questionnaires from, but I think if we could roll it into research and really, really dive into the statistics, it would be really interesting to see.
Yeah. And I think that one of the most important things from this as well is, as we said, to summarise, is knowing what the symptoms and recognising the signs.
Yeah, so that's the groundwork that we need to do to educate everybody so that they can self-select, so that they can be empowered. But then we also need to collaborate with the other healthcare professionals, that if someone raises that as a concern, to give them a voice and not to just squash it as it's normal, it'll pass, you've just had a baby. We need to, there's 2 things I think we need to do with that.
I think it's also about educating the fitness industry as well, though, isn't it? Because actually, I mean, not just Pilates teachers, but, you know, gyms, fitness instructors, PTs, if they did a screen that was a little bit more detailed. So have the knowledge to then signpost people, mightn't they?
Yeah, I think, again, that comes to the issue of people don't feel comfortable asking about wee and poo to their patients, to their clients, and it comes back to that. Yeah, but I think you're right. If we could have like a checklist or a screening tool that maybe they fill out before they get to the fitness person, and if they're not comfortable talking about it, they could maybe say, oh, I can see you've ticked this, do you know you can refer to this person? And all it needs to be is just sharing contacts, just literally collaborating.
That would be
massive.
So where are you going to go with this survey then, Marie?
Well, hopefully going to present it at an online conference in the pelvic health world in September, and then in September, hopefully, if the schools return and the nurseries go back to normal, we'll look at research projects and get that hopefully ethically approved, and then run out properly in terms of, like, hopefully be able to target more population, because we had 777 replies, but that was just an online platform of social media.
That's pretty good then.
Yeah, and in a month or like over 8 weeks, that wasn't bad.
Yeah,
So
that's pretty good.
yeah. But so there's just so much we can do or need to do. I don't know which way around that comes, but we just, yeah, the more we do, the better.
Yeah, and to be honest, the more talking about it, the better, isn't it? Because then, what I've noticed is that as we've started to talk about it more, women have started to talk about it more, and then maybe they'll talk to their mothers, their daughters, their
Yes.
sisters.
Yes. Like the power of 6. You tell one person, they tell 6, and then they tell one person. Yeah. And I know when I started teaching in England, I really taught a lot about pelvic floor. And I remember teaching my first general class, and I'd always cue the pelvic floor. And I only had 10 people in my class, but at least over half of them would say afterwards, I've stopped leaking. I've stopped leaking since I've started doing the pelvic floor specific how to do it exercises. I'm not leaking anymore. But they'd never disclosed they were before that. So it's interesting.
I'm certainly much more aware of it since I've done the Diamond Pilates course, because it went into a lot of detail, but it just made me think. And I know that I just did an informal survey just with my clients, and I was surprised at how many women actually. It was anonymous, so they probably felt more comfortable. And then from that, it's just spiraled into lots of workshops, really. And
so it'd be interesting if you added them up, have the whole, how many? Is it three out of 4? Is it 1 out of 3? It would be very interesting.
I think it's 3 out of 4.
Yeah. I would probably say you're right, and I think that was the same with my classes.
Yeah, it's really interesting, isn't it?
Yeah.
Well, thank you so much, Marie. That has been absolutely.
You're very welcome.
And I hope that we can re-interview in a few months' time. You can tell us all about a potential research project.
Fingers crossed. Childcare permitting.
Yeah. Well, I mean, that's the other thing about mums, isn't it? Just juggling everything is really difficult, isn't it? There's so many things to think about. Thank you so much, Marie.
You're very welcome.
Brilliant. I'm going to turn record off now.